And moving on, the United States has terminated thousands of life-saving grants globally, including HIV, malaria, and humanitarian aid projects. Now, PEPFAR, the President's emergency plan for AIDS, funded HIV organizations in South Africa and other grants to hundreds of African and HIV groups providing life-saving services have been terminated with immediate effect. Now, this has sent shockwaves around the global health community. In January, President Donald Trump announced an executive order to freeze all foreign aid for a 90-day pause to assess whether projects were consistent with his policy aims. Now, in the hours after the Trump administration announced it was cutting some $60 billion in funding, termination letters arrived at NGOs across the world. Now, the letter said that programs providing life-saving assistance against hunger and disease and performing other humanitarian work were being ended. The letters further said that the programs were being defunded for convenience and the interests of the US government. Now, major United Nations health programs were among those to get termination notices, including UNAIDS, the Stop TB Partnership, and scaling up nutrition, as well as projects helping displaced people. In South Africa, all 44 South African HIV programs through USAID have been terminated. South Africa has the highest burden of HIV in the world, with 8 million people living with the virus. It runs the biggest HIV program in the world, providing treatment to 5.5 million people. An alliance of health groups said the cuts are a crisis and people will die. Head of the leading Desmond Tutu HIV Foundation, Linda Gale Becker, said a halt in the US funds to South Africa HIV aid programs could lead to more than 500,000 deaths over 10 years. Now, for more on this, our correspondent Calden Ongmu has sent us this report from Johannesburg. Take a look.
Hundreds and thousands of lives are at stake after the Trump administration pulled its plug on contracts of some 10,000 projects receiving USAID grants globally. In South Africa, health experts have expressed major concerns. A doctor from Anova Health Institute in South Africa, which delivers HIV services to hard-to-reach groups, said this is one of the worst days of her professional life. She added that on Friday, they have to let go of 2,800 people from their jobs who are mainly peer educators and data capturers. A person living with HIV expressed fear and questioned on what is going to happen to the treatment from here on and how is she going to survive. Some experts have said South Africa is still at a much better place as compared to many other African countries. South Africa derives only 17% of its HIV budget from PEPFAR, while the Democratic Republic of Congo gets 89% of its HIV budget from PEPFAR, and Mozambique and Tanzania get 60% of the HIV budget from the US. This is Calden Ongmu from Johannesburg, South Africa for WION The World is One.